If you are a good observer, you can see that. They do what they want, and of course they like sweets. Most of the children, they like sweets. That's why they take homeopathy, right? What to look for? Disposition or innate traits. Always there is something which is peculiar in a child. This is known as disposition. Observation, gestures, postures, non-verbal cues, and doodles. You know about doodles, right? You just give a paper and let him do whatever he wants. He might draw a picture, he might draw a cartoon, he might draw his parents together, he may draw that the parents are going away or he is going away. Whatever is his feeling will come in the doodle. Whatever his feeling is. In adults also, I give them a paper and just tell them write whatever you want, draw whatever you want. And that really makes a big difference to your kids. Non-verbal cues, again observation, what the child is doing. You have to observe the child when the child enters, how he enters into the clinic, how he sits with his parents, whether he is sitting on his mother's lap, whether he is sitting separately. When he is sitting separately, what is he doing? Whether he is reading his book, whether he is moving around, whether he is touching everything. So all these are very, very small important things which you have to do while talking to the parent. Now you can't just sit like that and watch the child all the time. The mother is talking to you. That's not good. You will have to develop an art so that you talk to the mother, but you are watching the child what he is doing. Because watching the child, observing the child is giving you the clue to the remedy. I always feel observation is much important than the history. Before history, you can come to the remedy just by observation. Reactions in the waiting room with other children, very, very important. You look at children like phosphorus, carcinosin, they easily mix up with children, they talk with children, whether they are elder children, older children, younger children, they mix easily, they mix with the parents of the other children. Towards the doctor and parents, I told you about drugs like antibiotic root, I told you drugs like antibiotic tar, drugs like Sina, they don't like to be approached, they don't want help, just don't help me, just don't touch me. While Stramonium is always clinging to you. You need to differentiate this remedy because the child is going to come to you with some respiratory problem or some other skin problem, whatever the problem may be. But how to differentiate is very, very important. Behavior in the consulting room, attraction to particular toys. Every clinic, if you want to be a good pediatric homeopath, you need to have some toys. You need to have something in your room which will attract. You need to have small guns, you need to have some cars, you need to have dolls. All these things have to be there in the clinic. Because children automatically get, whatever the drug the child belongs to, he will get attracted to that toy. Anything which has to do with speed, which remedy? Tuberculosis. Which other remedy? Tarantula. Speed. Always they want something, they will look for speedy cars. Dolls, of course, our patients like Pulsatilla, Ignatia, Natramute. Even Silica would like to go into the mobiles. Most of the children nowadays look at mobiles and they are playing mobile games, think of Silica. Again, very, very, very monotonous task. Just sitting in one place, playing with mobiles, doing nothing. Carcinosin, again reading a book, very, very, very obedient children, nice children.